All right. Good morning and welcome to the New Species Live. I'm Jillian.
And I'm Aston. Good morning.
Morning. We're happy to be back live today. Thank you for your patience with our replays in the last 2 weeks. Hopefully, they reviewed some important information for you and that you got something out of them. All right. So, those of you who are with us for the first time, New Species is a natural health company. Our mission is to help our clients live longer and better.
Mhm.
We invent and manufacture our own line of raw, liquid, plant based herbal medicine and supplements that are designed to be powerful enough to support your body through the toughest of health challenges. Having said that, what is a good health choice? That is different for each of us, and that is why we host this Q&A every Saturday morning at 10 a.m. so that you can get the answers to your questions that will help you continue along your own unique health journey. So thank you for being with us today. We've got you on Facebook and Instagram and YouTube, and we look forward to answering all your questions today. We do have some pre-submitted questions that we can get to. So if you don't have any questions off the bat, we can start off with those. I do see that Olivia Bowen got started early this morning. Wonderful. So we'll start with Olivia's. Aston, did you see those prior to us getting started?
Maybe not. Let
Okay.
me take a look.
All right. So
Okay, so she did her CBCs, and I think you should send those to us, Olivia. So you can send them to me or
well, let's
to.
read them to everyone. So I did a CBC, which is your comprehensive blood count.
Just so
Right?
you know, you're freezing up a little.
Oh, I am.
I think
My connection
your
may not be that good.
may not be as good. So
Okay.
we'll
Can you
see how
hear
it
me?
goes. Yes,
No?
I can. Yes, I can. I can
I
hear and
can
see
change
you.
locations if you want to focus on Olivia's question, and I'll change spots.
Let's do that.
Okay, I'll change spots. You focus on Olivia's question, and I'll come right back.
Okay, sounds
All
good.
right.
So, hi, Olivia. I see you've done your CBCs, and your hemoglobin is a little low. You want it to be like maybe 12, 13, but that's not so bad. And I see your neutrophils as well. So the best, and your ferritin, the best thing for you to do is to send those into me, fax them into me, so I can get a closer look at all the red blood cells and the white blood cells. So the neutrophil is a white blood cell. The hemoglobin is a red blood cell. I like to see the whole picture of what's happening. I like to see the hematocrit and your RBC, and I'd like to see the other red blood cells to see you if you have any kind of other issues that we should be thinking through beyond what we discussed previously. Okay, so send those labs into me. It's hard to give you any specific guidance, not seeing the whole lab. And then I see you mentioned that you started the detox package with Queen Annie. I'm not sure what your question is relating to those, but yes, the detox is always great to have. For all of you, should be taking the detox actually, and I know you had been taking the Queen Nanny, Olivia. So send me the labs, and then I could do a comparative analysis with prior labs that you sent in. Okay, so do that. And while Jill is relocating, I'll take a look to see if there are other questions here beyond the pre-submitted, so that I can try to dig in here.
Okay.
So
I think I'm okay now.
what I suggested to Olivia is for her to just send in the lab.
Yeah.
She referenced in her chat, white blood cells and red blood cells. So I'd like to see the whole thing.
Right.
So,
I was able to actually continue listening while I wasn't
okay.
screen, so that was great.
So let us know if we can do that, Olivia. I'm actually in Bronxville today, so not sure where you're located, but if you're in the area, you can drop in and see me and bring them along with you. I'll be here until around 6 p.m. today, so feel free to drop in and bring those labs. And if you have other questions, you can fire away and with me with them.
Okay. All right. So we have a question. So good morning, June. Hi, Fitzgerald. Hey, Trevor. Got Olivia and Carol. Good morning, Maxine. Thank you all for saying hi. See, there's a bunch more of you watching who aren't saying hi. Maybe you're driving, so I will forgive you.
Oh
All right.
boy.
Carol says, good morning, Julian and Aston. I finally got all my required stuff from you that I picked up and ordered. As you mentioned, I'm along my way to better health. That's great. I sent recent blood work. Her question is, um, she says, I need, I think there's a typo in your question, Carol, because I'm not sure if I'm going to interpret this correctly. Okay. Hi, Jay. Hi, Gwen. Thank you. She says, I need to increase my white blood cell count.
Mm-hmm.
I'm not sure if Carol's assuming you've seen her labs, and that's why she's saying that.
Yes, I actually spoke with her recently. So, Carol, if you're taking the LNU, any LNU, and the new Genesis, if you're taking those two, your white blood cells will go up. And that goes for all of you. If you're taking any of the NuSpecies LNU, whether it's the LNU1, the body system, or the 9, LNU9, the legend, or the LNU25, the super caveman. With the new Genesis, your white blood cells will go up. And you all notice I didn't say may. We don't use words like may when we talk about serious issues like these and comes to NuSpecies. So just stay on those, Carol, and you'll be fine. And that goes for all of you. You should all pull out your blood test report right now, all of you. Pull it out right now and check your WBC. If your WBC is low, your immune system is significantly impaired. The WBC is way more important than all the other white blood cells marker in your lab, and there's maybe 16 or 18. The WBC far more important, people. Okay, so and if it's too high, it means that you're fighting a really, really grave infection. So all of you pull out your WBC and let me know on this call if your WBC is low. All of you pull it out, especially those of you who are of African ancestry. The doctors will tell you that is because you are African why your white blood cells are low. And it's complete garbage, nonsense, absolute garbage, nonsense. And I can explain later, but let's move on to the other questions we have where you all are digging into my chart or your draw and checking your WBC. WBC is one of the most important markers in any blood test. One of the most important ones. That's why I am asking you to do that. All right. You can take it away, Joe.
Sure. All right. June is telling me I need some NuSpecies for my throat. June, you'll know that it's taken it's NuSpecies that has kept my situation only at this.
It is NuSpecies why she is able to be on the stream this morning.
Yeah. Like I say in the beginning, NuSpecies formulas will help you stay resilient against the toughest of health challenges. They do not guarantee us immunity from all problems, but we can feel as good as possible when the inevitable does happen. All right, Carol said, she says, yes, she's on it. I'm assuming whatever product you were saying. She just took them about a half hour ago.
Good.
She said her white blood cell count, I'm assuming is what she's referring to, is 3.4.
Yeah. So you're good, Carol. Just stay on those with what you're taking. You'll be fine. They'll go up. You do your labs in 2 to 3 months. And that goes for all of you as well who are on NuSpecies and you're working on any particular issue. You should be doing your labs every 2 to 3 months. And if you have issues with your primary care or your doctors in their refusal to do your labs within 2 to 3 months while you're working in NuSpecies, while you're working in your issues, whether it's your cholesterol, your diabetes, or blood pressure, whatever the issues are. If I ask you to do a lab in 2 to 3 months and your doctors are not doing it for you, you should let me know, and we can refer you to some partners we have who can perhaps help you to get it done. Okay? All right.
All right. We'll say good morning to Carl. Thank you for joining us. June says that she'll be getting labs done this month and she will send them to you. So that's great.
Okay.
Olivia can just clarifying that she's in Canada. And so she'll send those labs via WhatsApp. Or no, she sent
Okay.
them already by WhatsApp along with her mammogram.
So let's talk about that, Olivia. And again, this goes for all of you. We are not comfortable with any of you sending us labs via WhatsApp. I personally don't know if it's safe. And I would not want any of you to have your confidential information. You probably all wouldn't send me your credit card number and WhatsApp to me, right, folks? You wouldn't do that, right? You wouldn't put your name, your phone number, your credit card number in WhatsApp to me. Would you do that? No. Well, guess what? Your health information is 1,000 times more important, more confidential than even your credit card information. So please email us your labs or fax us your labs. Don't use WhatsApp. I don't know that it's safe. I don't believe that it's safe. And that's why it's free. So I implore, beseech all of you not to do that.
When you send an email or a fax to us, it goes into a HIPAA compliant database. So we feel very comfortable with you doing it that way. So even if you send your information to support@newspecies.com, it goes to a HIPAA compliant database. All right. If she did already send them through WhatsApp, are you not even using that anymore, or are you still checking that?
I don't check it much. And I guess I should, because we have a lot of clients in other countries around the world. And it's just an easy way for them to communicate with us. Unfortunately, a lot of them do out of desperation, because they're sick, they're not well, and they just want to get help, and they're not thinking about the confidentiality of their personal and health information. So I guess they're not able to fax, but they can email, right? You all can email me from anywhere in the world. You can email support at newspecies.com. Did I say the right email there?
Mm-hmm.
So, and that's safe, folks. So please just email it to us rather than WhatsApp it to us if you're not able to fax, or just drop it off at the NuSpecies office.
Right.
Yeah.
Okay. So Carol was Olivia said her white blood cell count is 3.8.
Okay, so that's not bad. You need to get it to 4.5 and above, Olivia, and you're going to be in good shape. And I want to know the rest of you want to know what your WBC is. All right.
Carol said she's going to send her labs in 2 months' time. She does the labs every month and she hand delivers them, so that's fine. Okay, so Yvonne is just reminding you, Yvonne Brown, that she didn't get her phone call yesterday. I'm sure you know that already.
And she's right. And I'll give you a call first thing today, Yvonne. I think you were the last person on my calendar, and I did not get to you, but I will get to you first today.
See, perks of the Q&A can get your appointment at the top of the list.
I can't hide away, can I?
All right. And then Trevor is saying his white blood cell count is 5.9.
That's pretty good. Pretty good, Trevor. Pretty good.
And his red blood cells are 4.66.
That's pretty good as well. Pretty good. Pretty good. All right.
Go Trevor. All right, GE James says, I'll reschedule to speak with Aston next week after my lab work. Okay, so I assume G, you could just text us and let the team know you want to reschedule so we can move your appointment. I'm not sure when it is off the top of my head, but we could figure that out.
Mhm.
All right, so as you all know, those of you here live get priority, but Yvonne says, no, you can't. You can't hide. Um, so as you all know, those of you who are on live, we're going to prioritize your questions and comments. But if we don't get any further ones, I'm going to move on to the ones that were pre-submitted. So I'll do that now, but we'll keep an eye on the chat. Okay. Let me actually double check Instagram, make sure nobody over there has a question yet. Nope. Okay. So we have a pre-submitted question from Audra. She went into some detail. So let's see here. She was wondering if she's on New Genesis, should she stop taking the God formula and start taking that? She's still taking L-9, the detox blood, and she thinks God formula when she comes home every day at 3. She's still working on her blood pressure and taking medication for that. She is asking about a weight loss drug, Mounjaro, but that's a separate point. Oh, she has already been on it for 2 months and lost 10 pounds, but she doesn't want to stay on it. She really prefers a natural method. She does have degenerative arthritis. She is contemplating knee surgery, but she is taking the MSM, calcium, the vitamin D. She knows she has to schedule an appointment with you, but I guess overall, considering this whole situation, should she be adding New Genesis in or replacing a current product with it?
So I am checking your chart, Audra, and don't worry, I won't divulge your confidential information. I think you should continue taking the God Formula 4 you must continue taking the God Formula 4 for the reasons we have discussed. And yes, you can add the New Genesis, and the New Genesis is going to help your immune system to get empowered a lot faster. And based on the issues that you want to get help with, the New Genesis, along with the God Formula, will help you to get better quickly. And I'm sure you want to get better as quickly as possible. Beyond that, since I won't discuss the details of your health, I see that you haven't called in a few months, Audra. So get your butt on the phone and give me an update on how things are going one-on-one, okay?
So it looks like she did something that I normally do is she kind of typed herself into her own answer because as she kept listing all the things she's working on, it kind of sounds like she knows she just needs to add on New Genesis and that she knows she needs to catch up with you. So that's good. But I'll make sure if she's not on today, we'll send her this clip so she knows that we answered her question.
Okay.
All right. Sandra Lee is on the live chat saying, good morning. Is New Genesis good for arthritis of the knee?
Okay. So Sandra, tell me, are all those other pains you had for the last year or two, are they now gone? And if they're gone, yes, New Genesis has been showing tremendous promise in helping people with pain. And that's any pain, whether it's arthritic pain or just other pain. So I know that you had used it at least once, New Genesis, so you should continue on it and add in the MSM. So for all of you, the system that we have for pain, if you have chronic pain, you're not getting help from your doctors, you're taking all the medication, not working. So we have four formulas that you can use together for pain. If you have pain that's just not going away, you're suffering. The first one is the LNU25, and you can take it by itself or you can take it along with the New Genesis, the MSM, and the bee pollen, any of the bee pollen. So those are the four formulas For people who have chronic pain, what we don't now do is recommend all four of those to be taken together at the same time. So if you're suffering, you have pain, whether it's arthritic pain or other pain, headaches, if you have migraine headaches, any kind of pain, back pain, a lot of you have sciatica, you have any kind of pain, the four formulas you can take together, and it will work the money and work your sacrifice. Take the L-25 along with the New Genesis, the MSM, and the bee pollen. And I'm not sure if you have taken all of those together, Sandra, but I know that you were getting some relief from your pain. So you can give me an update on the prior pain that you had that we had been working on, that you had told me you were getting better. Let me know if that's the case, if you're still doing well.
So my follow-up question to that would be, as you know, NuSpecies can help people with symptoms, but we
Mm-hmm.
always prefer to actually help those symptoms go away because the root cause is getting repaired.
Mm-hmm.
So in the case of this chronic pain package, is this a package that supports like the reduction of inflammation or things that cause pain? Or is it also actually repairing whatever the root damage might be?
It is, and that's exactly how it works. The LNU-25 is the rebuilder, is the most powerful rebuilder we have generally for the whole body, right? The LNU-25. So all pain is nerve pain. Doesn't matter where you have it, in your toe, your finger, your brain, you have cancer pain. All pain is nerve that are damaged, nerve that are exposed to oxygen, and that's what chronic pain is, or any kind of pain. That's what it is. You get a cut, you feel the sting and the burning, and then the pain is because the raw wound, the nerves in the raw wound are exposed to oxygen. Oxygen is burning the nerve. That's what pain is. So the MD25 will help to rebuild the nerves and the tissue that are damaged or inflamed. And then the other formulas like the New Genesis, the MSM, is going to help to, the New Genesis help to power genes in DNA. When your genes in DNA are powerful and firing the way they should, your body's going to heal faster. And as those of you who are taking New Genesis now, you're eating your good foods, and New Genesis you're taking going to make those foods to work even better for you, because now your DNA and your genes are more powerful. They're working better. So even the foods you eat, your body is going to use the foods you eat even better. The NuSpecies you're taking will work even better and faster for you from taking New Genesis. And of course, the bee pollen is the formula that we use primarily we use it for a lot of issues, but it also helps with pain because of the antioxidant power in bee pollen. It creates a lot of oxygenation in the body, and that's why it creates so much energy for a lot of people who take it, especially the people who run or exercise. So the bee pollen, the MSM, the New Genesis, and the NU25, that package, yes, it's also helping you to rebuild your body as well. It's rebuilding nerves, rebuilding your body. It's doing a whole lot. It's just doing so much. I probably could write a whole volume on that for you folks.
Mhm.
And maybe I should start writing again.
Yes, that would help me. All right. So good morning, Marie. Good morning, Darnett. Thank you for joining. June says in her white blood cell count is 7.3.
Woohoo, June, you're firing on cylinders there. That's pretty good.
What would
Wow.
be too high?
Probably over 10 or over 11.
Would that mean you have like an infection?
Yeah.
Okay. Her
Yeah.
red blood cells are 4.53.
Pretty good. Pretty good. June, boy, new species. I'm taking credit even if you're not taking new species.
No, she's been on it, and she's been that actually was back in November of 2023, and she was on our products then too. So
Mhm.
I'd be curious to see what this year's labs look like.
Okay.
All right, Carol is saying, "Hi guys, my sister had back surgery, and then recently re-injured her back. Oh gosh, I'm sorry, Carol. She said therapy is not working. What can she take from you?"
Well, I'd like to know what the injury is. It the spine? Is it Carol? Carol asking? Is it
Carol
her? Is
Johnson,
it her?
her
Is it
sister.
the disc in her back that are injured, or her spine in general, or just the muscles? It's important to know to make the distinction if you know, Carol.
All right, yeah, Carol, follow up and let us know. Don't be shy. Keep typing away. While we're waiting for Carol to clarify, because I'm not sure if those same products you mentioned earlier, but I'm assuming her back is in pain if she's injured it.
Mhm.
But also that some repair might be necessary, right? Like normally you would say like calcium and MSM and
Right, that's why I'm asking. So, Carol, you could also find out if she previously was diagnosed with arthritis or if she has arthritis now as well. That's very important to know.
Hmm,
Yeah.
okay. In the meantime, Carol said her disc.
Okay. So that's why she's not able to get any help, Carol, because maybe some of the discs have slipped out. That's why they call it slip discs. You know, the little joints. So she will need to be. And Carol, how long ago she was injured? So I can get some idea as to how bad it probably is now. Now that you're saying that the doctors are not able to help her. So if you're able to tell us how long ago she injured her back, that would be good to know. And also if she has arthritis.
Right. And then also like how long has she been doing therapy where like who's saying it isn't working? Is it just not helping with pain yet? Are the doctors saying it's not working? How do we know it's not working? And I wouldn't stop therapy, right? Regardless.
Right.
Yeah.
Right.
Okay.
Yeah. So get back to us, Carol. You can ask her, and then we can pick it up.
Okay.
Mm.
Fitzgerald is saying, my doctor is anxious to know what it is that I'm taking because my vision is 2020. That's excellent. I
So let me
I
say,
told hold on. I told her about NuGenesis, but she still thinks it's the medication. Since when has a
yeah.
medication improved vision?
So quite a few people have been telling me that the new Genesis has improved their vision and their heart health. So those of you who are taking New Genesis, you can give some feedback. Keep in mind that I know what this formula is for, but we need the proof from you. You have to give us the proof. And if it's not working, tell us as well. Tell us what you're taking it for and why you think it's not working. So I want the good, the bad, and the ugly. And in your case, Fitzgerald, I just checked my record and see that I have your home address. So I'm going to send you a special bill. Now that you didn't buy it for your eyes. So you're going to pay for the results you're getting for your eyes.
That's the best thing about the body is that everything's connected. So when you make something better, it means that your body can now focus on other things. There's a domino effect in the positive way. So when we feel like we're falling apart and everything's going wrong, it can happen that same way. Everything can start going right. And it's not a miracle, it's just the way the body works. It's awesome. All right. And then Diane Miles asks, is New Genesis good for the eyes? Did you have that in mind
Um,
when you designed it?
no, it's for the genes. So let's talk about New Genesis because I see quite a few chats here about it. Even those that were submitted, preset one that was pre-submitted. So New Genesis assess the body to purify, rebuild the genes and the DNA. That's what it does. So it's not one particular gene or DNA that's being rebuilt. It's the whole body. It's the DNA and the genes. The genes are made by the DNA. So it's the DNA and the genes in your whole body that are getting repaired. That's why this formula is so important. And that's why I've been trying to finish it for over 20 years. And now we have it and it's out. So if you're taking New Genesis, it's going to support your whole body. It's going to support all your genes. So if you have genes for your heart, a gentleman I spoke with earlier in the week was saying that his doctor is amazed at how his AFib is improving. And, the doctor even used a miracle word. Well, we don't believe in miracles. So, but if you're rebuilding your genes, if you're supporting the genes in your DNA, people, your body will start to function better. And that's why I said earlier, even the foods you're eating at home, your body will be able to utilize those foods even better. And if you're taking NuSpecies along with NuGenesis, NuSpecies is going to work even better. The fact that you're supporting your genes and your DNA. So that's the importance of the formula. And that's why those of you who have been joining us for the last several months, since we have launched NuGenesis, you have heard me said, I want all NuSpecies on NuGenesis is for that reason. All NuSpecies need to be on NuGenesis, and that's why we're making it half price for now. And that is to get all of you to be on NuGenesis. Even 1 or 2 bottles you should have. And yes, it's going to help your body to repair in all your body's form, everywhere. It's going to assess. I'm not going to say it's going to make issues go away. I'm not saying that. I'm saying that it's going to assist your body to fix issues.
Right. And something to keep in mind is, and I know because you have a certain issue, you're always going to ask, is this formula going to help with this issue? We can't leave out the fact that your body is actually in between those two, right? So there's the product, there's your body, and then there's the thing your body's suffering with. When you take any NuSpecies formula, it has to be utilized by your body. And then your body will decide what it's going to fix. So Aston isn't going to play God. He's going to say, I know the body could use this toolbox. But at the end of the day, we can't force your body to do anything. Your body's going to decide how it wants to use that toolbox to accomplish whatever needs to be accomplished. And that sometimes doesn't happen in the order we want it to happen. Sometimes we get way more results than we expected. Sometimes it takes longer than we want. So keep in mind that every NuSpecies formula can help you in a diversity of ways. And so sometimes it might sound like we are repeating ourselves about how the formulas support the body, but truthfully, the body has to fix itself. And that's how our formulas end up helping, is by helping the body. Aston's in Bronxville, so yeah, someone must have walked in. You can mute yourself if you need to. I'm gonna scroll back. We've got a couple of things. So, morning, Glennis. Hi, Richard. Hey, Junior. Thank you all for being here. Hi, Diane. All right, so I'm gonna scroll back a little bit. So just to put a pin in the answer to Fitzgerald is that NuGenesis could be helping his eyes, could be helping his body help his eyes. Yeah.
Absolutely. NuGenesis is going to help your body overall to fix, because every organ we have relates back to genes. Every organ, the eye, or hair, or skin, or teeth, or heart, prostate. Ladies, if you have breast issues, ovarian issues, uterine issues, every organ we have relate back to genes. So it doesn't matter what issue you have, the NuGenesis can help the body to start fixing the issue. And especially if there are genetic issues like cancer and issues related to prostate for men, for women, it's breast cancer or ovarian, uterine, all these issues. That's how important the NuGenesis is. So I think those of you who joined us 3 months ago when we launched NuGenesis, you're beginning to see now why we made such a big deal of it. What you're seeing and hearing is what I've been hearing for the last 4 years about NuGenesis from the people who have been using it unofficially. And of course, we just brought it out now that it's approved by the FDA. That's why it's out officially with NuSpecies. But the results that you're hearing now is what we have been hearing for all sorts of issues: heart issues, blood pressure, prostate, breast cancer, all different cancers. There's a lot of issues, a lot of feedback we've gotten from a lot of people around the world who have been taking this formula.
Rosemary Taylor says, I can testify that New Genesis works wonders for me. I was suffering terribly from muscle contractions. And since taking it, I can do anything without having muscle contractions. That's
So,
huge.
so we're collecting addresses now, home addresses to send out special bills.
That's
I'm kidding.
wonderful.
I'm
Thank
kidding.
you for sharing, Rosemary. Another quick question. Diana is asking if New Genesis can be taken along with God Formula too.
Yes, New Genesis can be taken with all NuSpecies formulas. It doesn't matter what you take in the detox, all our formulas you can take New Genesis with.
Okay.
Yeah.
We're going to just get back to Carol. She followed up with some more information about her sister's back.
Mm-hmm.
So she said it's been about years. That's a long time. There's no arthritis. She's saying that the PT is fine while doing it along with massage, but afterwards it's back to pain. And she just re-injured at work 6 weeks ago.
Okay.
Yeah.
So what you can do, Carol, you or she can get our joint system. She could start with that and add in the New Genesis, of course. Just you could start. She could start with our joint package. It's a very basic package,
Let's see if I can.
and just add in the New Genesis. And at some point, she should schedule an appointment with us, with me, or the species RN.
All right, I'm gonna put the link. I'm actually gonna put the link to the section because there's a joint supporter and then there's also an arthritis supporter, just in case those are necessary.
And while Jill is doing that, just to give you all some knowledge that we have gathered over the years, over a decade of the new species, or almost 2 decades. So those of you who have joint issues or back issues, particularly back issues, if you have herniated disc, slip disc, if you have sciatica, you have any of those back injuries, and a lot of you may have been taking epidurals for these issues, and the epidural is just hormones they use to numb the nerves that are causing the pain. But as soon as it wears out, whether it's 6 months or 3 months or a year, the pain comes back, and the issue over time gets worse. So all of you, if you're suffering any kind of joint issue, arthritic issue, but especially back issues, what we have seen, the best way to fix those issues, literally, those issues can be fixed, and your doctors may not be able to help you to do that. This is the way we have helped a lot of people, probably thousands of people over the years, to fix these issues, or to get rid of these issues, or to get these people in a place where they have a really good quality of life. They have a better quality of life, even if the issues are not gone completely. You take the NuSpecies joint package or the arthritis package, and you should do massage therapy. Massage therapy, not the regular therapy that your insurance will pay for. You should do that as well. But a lot of you can't even do that because it's so painful. And when you do a lot of those therapies, you're out for days, and some people stay for weeks. They just can't even walk because they can, it gets so worse. So what you need to do is take NuSpecies, take our joint package or our arthritis package, and do massage therapy. Now, what I've advised a lot of my clients to do, you don't have to go out and pay a therapist to do that, because it's a lot of money. It's going to be like 70, 80, 100, over $100 per session. Just get a family member, get your daughter, get your son, and pay them $5 or $10, because you only need to do the massage for maybe 20 minutes, half an hour, the longest. And what you do is very light massage. Don't rub and press and push and all that stuff. Don't do that. It's not going to make things better. The harder you do that, is the more inflammation and more irritation you're creating, and that's not good. The massage therapy is just to get the blood to flow. Once the blood is flowing with NuSpecies in it to these areas where you have the pain, the sciatica, the herniated, whatever it is, that's how your back is going to heal itself. And then eventually, if you have slip disc, those discs will fall back into place on their own as soon as the muscles get stronger, as soon as the inflammation recedes, as soon as the blood circulation is getting to those tiny blood vessels that are impacted where the discs are. That's how you can get your spine or your disc or the joints in your back to heal over time. Do that, and the results you see will be amazing. And again, the massage therapy, no, just very gently. You can get coconut oil or something like that, something natural, and just do it very gently, just to loosen the muscles so the blood can flow. It's the tightness that's causing the slip disc. It's the tightness that's wrenching those little bones out of their sockets. And you just need to do very light massage therapy to release the stiffness or the tightness in the muscles so the blood can flow. All right.
If you can afford a massage therapist, and you know you need to see them regularly for a while, you should ask them if they could give you a better price if you commit upfront to seeing them weekly for a period of time, and they may lower their price and give you a deal. I've asked for that in the past, and they always agree. So, if it's something you can afford, then I would do that. All right. We have a couple more questions, and I think it's going to be the all the time that we have. So I did answer GE James, but I wanted to clarify with you, Aston. So GE James was asking if we have a doctor on board again yet, and I said no, not yet, but that you are working with an NP who is providing a much more affordable way for those who are a good fit for what she does to get the blood work or testing that they need. And that's something that they have to talk to you about to get the referral if you think it's a good fit.
Yes, so we do have a few NPs, they're NuSpecies, who they don't work for NuSpecies, but they're people I have known for years. One of them did work at NuSpecies for quite a while, and they have a practice. So, and that's why I mentioned earlier, those of you who need labs done and your doctors are not able to do them or reluctant to do them, we can refer you to this team and they can assist you to get your labs done. And but when you speak with them, you are building a relationship with them. I trust them, but they're not NuSpecies. They're not under the NuSpecies brand. But we work with them to assess a lot of you who have all these issues and your doctors are not able to help. And we're still trying to figure out the best way. Now that we did the medical practice and we have a lot of lessons learned, we're still deciding the best way to do that at NuSpecies. It will take some time before we get to it because the lessons learned we had were pretty significant. And one of the number one lessons learned from all of you is that you did not want to talk to the doctor. You still wanted to talk to me. So that was one of the biggest downside in having that practice, is that you did not want her. You wanted to speak with me. So we're going to work through that as well.
Right. Judah Brand is asking if they're in New Jersey. They're actually in Brooklyn, but I believe that they can get you the prescriptions you need for labs remotely. Right, Aston?
Right. They do virtual and in person. So when we refer you to them, you can decide if you want to see them in person or if you want to do virtual.
Right. Yeah. And we would just refer you straight to them and you would just talk to them.
Yeah.
But they're crazy about NuSpecies. I mean, they're constantly recommending their own patients from where they work to NuSpecies, constantly asking Aston, what should this person take for this? So they're really would be a huge advocate, but they don't work for us. So it would just be a complete referral outside NuSpecies for those labs that you need. All right. Quickly, someone on Instagram had asked if we were going to be setting up a store in South Florida. And so I did answer, but for the benefit of everyone, We don't have any plans for any permanent stores in Florida, but we do have plans to begin making some regular trips out there with product to meet all of you and to help get you access to products if you don't like shipping. So if please join our email list, because that's how you will know if when we start doing this. So just go to the homepage of NuSpecies.com and a pop-up will come up and you can join our email and our text list. Even put your birthday in so you can get a birthday discount, and we will let you know when we're going to be in Florida. Okay. And then I don't want to miss all of you here. Okay. All right. I think we'll only have time to get to Fitzgerald. I'm not sure if we can get to you, Queen Nesta. Let's see. Aston, I'll tell you both of the questions just in case you maybe want to try to hit both before we end. Fitzgerald's asking if you could discuss a hiatal hernia and how NuSpecies can help, if NuSpecies can help. And Queen Nesta is asking that her main issue is bone pain, left back, radiating left side. She does have arthritis. So two different things, but I don't know if how you want to handle, if we can get to both of those or not.
Okay, so the Fitzgerald, yours is easy. When it comes to hernia, we can help the body to not make it get worse, but we have not been able to help a lot of people to make the hernia go away completely. We haven't been able to do that. It's one of those, out of the probably 18 or 19,000 named diseases in America, that was one that we have not conquered. When I say conquered, I mean we have not been able to get over 90% of our clients to get rid of it altogether. But we can help people to live better with it, to make sure it doesn't get worse. And especially if they decide not to do surgery, we can help them to alleviate the pain, the stiffness, and just the misery of it. But we have not been able to get the body to regrow those damaged muscles and tissue. So it's still on the drawing board for NuSpecies. But they can take the formulas we recommend for hernia, and it will help the body to not make it get worse, and gradually it will get better. But I don't know that it will go away completely. For some people it did, and for others it didn't, and we don't know why. For others it went away, and for others, and then the others it didn't. We don't know why.
Right.
As far as, did I answer that?
You did. I was just going to add on that, as much as we want NuSpecies to be the solution for everything, and I know you're like us, if you can avoid medical intervention, you want to. But sometimes medical intervention is necessary. And the good news is, as we say in the introduction of the show, that NuSpecies is here to help you be resilient against the toughest of health challenges, which means that even sometimes when you need a medical intervention that could have dangerous side effects, or potentially the healing process could come with potential infection or bleeding or other sorts of symptoms, you have NuSpecies on your side to keep your body as strong as possible, and as ready as possible to fight and heal. So it can help you go into those situations with a little less fear, knowing you've got a real strong support system. All right. And then so now you can move on to Queen Nesta.
And just to add a little bit to what you
She's
said,
taken everything but not the bee pollen, is what she's saying. It's the only thing she hasn't taken when it comes to pain.
Oh, so then, and she can add in the NuGenesis.
I don't know if she's taken that. Queen Nesta, have you taken that?
So NuGenesis, MSM, and Nu-25, bee pollen, take those together, and because when she said radiating left side, Lester, do you mean you took radiation?
I kind of interpret it as like the pain is radiating like around her left side, but you're right. Maybe she means something else. She said yes. Yes, NuGenesis and no radiation.
Okay, good.
Okay.
Right. So she just go on those 4 and stay in them, stay in them. And that's how do you know it's bone pain and not muscle pain? Were you formally diagnosed because you did a PET scan or MRI or something? Could you tell us why? And speaking of bone pain, the gentleman I spoke with yesterday, this is why all of you, if you're feeling any pain, even in the legs, and it's not going away for weeks, you should get it checked out. Spoke with a gentleman yesterday who was on my calendar. He was having pain at his hip, and he just thought he lifted too much weight. He was doing stuff around in his basement and garage, and he ignored it for several months. And he went back to the doctor, and the doctors actually found cancer in his spine, in his hip, and the cancer was moving. So he has to be now on chemo. So the point is, if you're having an issue for a number of weeks or months and it's not going away and it's there, you should get it checked out, because the easier you detect an issue is the faster we can help you with that. When it becomes advanced, like hernia, a lot of people who come to me with hernia, and one of the reasons we weren't able to help some of them was because they had it for years until it was really bad. It was really bad. And so some issues in our bodies, especially DNA or genetic wise, they can get so bad that the body may not be able to get rid of them altogether. So the sooner you catch an issue, it's the easiest it is for us to help you to resolve it.
So she replies that you had, in your consultations with her, you had determined it was bone, and that it started with sciatic pain 3 years ago.
Okay.
Static pain was how it started.
Okay.
Well, now I'm not sure if she meant sciatic or static, but I
Okay.
feel like sciatic makes more sense.
So as long as there's pain, those 4 formulas, maybe Queen Esther, you weren't on initially. We were talking about how we have helped people with pain. So you can get the LNU25, the Super Caveman, the MSM, the New Genesis, and any B pollen, whether the regular or the stronger one, you can get all 4. And that goes for all of you for any pain. Even if it's your children 6 years and over, you can put them in that. So it's for everybody. All NuSpecies products can be taken by everybody, including children 6 years and over. Okay.
All right, I'm just typing those in. So New Genesis, MSM, LNU25, B pollen. Oh, did I lose you? Are we there?
Oh, I'm here.
Okay. All right. So I typed in New Genesis, MSM, LNU25, and B pollen.
Sounds good.
Okay. All right. She said thank you. All right.
Okay.
And, maybe try to get an appointment on Essence calendar just for like a month from now, or whenever you start using the product. So that way we've got you reserved on there to check in to see how it's going.
Yeah, I'm going to check to see the last time I spoke with the Queen.
All right. Carol had to run. She said, thank you guys. Have a great day. Blessings.
Okay.
Blessings to you too, Carol.
All right, Nesta, also get on my calendar, young lady. Okay.
Yeah. Okay. All right, guys, we have made it to the end of the show. This was a wonderful conversation. Your questions are always so amazing and so inspiring. If you noticed in our email newsletter today, I included some clips from a previous episode where I think we hit a certain point pretty well. And we get these clips and these FAQs answered because of your questions. So this is always so fulfilling for us to be here with you. Thank you so much for giving us your time. And remember, you can ask us questions anytime during the week. Just go to the app and there's a form where you can submit your question. That way we always know, that way you don't forget, because sometimes you get on the show and then you don't remember until it's almost over what you wanted to ask. So submit your questions anytime on the app. You can download our app off of any app store on your phone. If you haven't subscribed to our NuSpecies YouTube channel yet, please hit the subscribe button today if you can. And you can always hit the notification bell so that every time we send new content, you'll get a notification. And please also join our email list and our text list. You can do that very easily on the homepage of our website. There's also a link in any of the descriptions of our videos on YouTube that'll take you right to the form to join our email and text list. We don't send many. Most people want to hear from us more, so you won't get harassed. But it's a great way for us to be able to, so you don't have to do any work at all. We can just keep you informed with everything you need to know.
And I want to thank you all for everything, including, your feedback on New Genesis. The more feedback you give us, and the more feedback we get from other clients and other NuSpecies family, is the more confidence we will have to recommend New Genesis and our formulas to other people around the world. So what you all are doing, especially what you've done today with all this feedback, you are helping us to be able to help more people out there who need help. And we can't get enough of hearing this from you, the feedback from you, so that, and especially with, if you have issues that you weren't taking New Genesis for, or NuSpecies for, and you're getting help, let us know as well. We don't know everything. We seem like we do, but we don't know everything. We don't even come remotely close to knowing everything. We don't know everything. So, but having you on our side with NuSpecies is what help us to expand our knowledge base and our information base and being able to help more people. So thank you very much for all the feedback you have been giving us.
All right. Please subscribe before you leave today. Like our content if you can. Join our email list and download the app. And then you're fully integrated in the NuSpecies family. We'll see you. We do need each other. That's right, June. That's absolutely true. It's a win-win relationship. I always say that NuSpecies, we have to make money, obviously, to stay in business. We can't make money if you don't get results. So we only win when you win. And we like it that way. So that's why we need your feedback. And we want to communicate with you like this every Saturday at 10 a.m. Because it keeps our family strong and it helps us continue to support you. So thank you all. All right. We'll see you next Saturday at 10 a.m. And in the meantime, have a wonderful, wonderful week.
Okay. Bye-bye.